Naruvi Hospitals, promoted by the Sanko Foundation, is the brainchild of the founder-chairman Dr. G.V. Sampath. Belonging to Vellore, the medical hub of India, Dr. Sampath's vision to create a medical destination for the people of Vellore in particular and others from India at large and also overseas resulted in the establishment of a hospital here, a real crown jewel in the field of healthcare. Large numbers of people belonging to Vellore and the surrounding districts have been known to travel to Chennai and Bengaluru, both nearly 200 kilometers away from Vellore, seeking medical care due to the dearth of facilities and the hardships faced by the locals to access available services. As per the vision of the chairman, the best in healthcare, both in terms of medical and nursing professionals as well as sophistication, were infused into the institution, making sure that patient affordability was addressed at all times. Less than a month after Naruvi Hospitals opened its doors to the public, the second wave of COVID loomed large as life. We took on the challenge and quickly rose to the occasion, catering to the local population and some from outstation as well, adding close to 40 critical care beds and over 200 ward beds to the COVID care pool. Much as it was hard for a 1-month-old hospital to handle such large volumes of very sick patients, Naruvi Hospitals was able to contribute significantly in our country's efforts to save people from the disastrous end that COVID was driving people to. Naruvi Hospitals is positioned as a high-end tertiary care center. Our focus on ethics, transparency, patient satisfaction, and an academic outlook in everything we do ensures that doctors, nurses, and others in the care team are performing at their conscientious best to not only treat patients' ailments, but also to make them happy overall when they leave our hospital. We have tied up with the Henry Ford Health System, HFHS, based out of Michigan State in the United States of America. HFHS is one of the old and leading healthcare delivery systems in Midwestern America. The main aim of this tie-up is to have constant transfer of knowledge and to get access to the time-tested practices they have been following for decades, which ultimately translated to patient care. Naruvi Hospitals is a completely paperless and filmless hospital. The Naruvi philosophy of care is embodied by our motto, Fragrance of Care. The doctors in Naruvi are largely trained in the best of medical institutes in India and come with years of rich experience in their fields of expertise. With the philosophy and its pallbearers, the medical and nursing professionals, the high-end equipment, and the building infrastructure complete the holistic picture of Fragrance of Care. The hospital is 475 bedded with a 25% critical care bed count. Naruvi Hospitals boasts of an over 5 lakh square foot building spanning 14 levels. The building is completely air-conditioned, conforming to ASHRAE standards with zone-specific air conditioning to reduce cross-infection between different care areas. Our laundry is 100% barrier washed. We have a top-of-the-line sterilization department with machines with 95% water-saving machines, saving up to 300 liters of water every running hour. We have all the major medical and surgical specialties. There are 16 modular operation theaters with laminar airflow. All the equipment in the ICUs and OTs are pendant mount to avoid clutter on the floor. All the departments are equipped to the most modern standards with the best and latest equipment so as to be able to provide the best end-to-end treatment to our patients. State-of-the-art cardiac cath labs, the latest robotic hybrid OT, ECMO, interventional pulmonology, high-end orthopedics, general and bariatric surgery, epilepsy monitoring unit with robot-guided epilepsy surgery, neuro monitoring, navigation, the latest lithotripter, urology laser are just some of the arrows in our quiver. Our primary focus, though being the local Vellore people and Indians at large, we are working towards attracting overseas patients as well. We have started an office in North Sudan in Khartoum. We're in the process of tying up with the governments of Oman and Seychelles as well. In all, Naruvi Hospitals is more than a hospital. It is an experience.
Hello and good morning to everybody. May I please request our panelists to kindly turn on their cameras as we will get our webinar started. Yes, thank you very much. So with that being said, a very good morning once again to everybody present here. A warm welcome to you all to today's webinar on stress, the silent killer of one's heart. My name is Hiba and I'm delighted to be the moderator for this session. This insightful session is brought to you by Naruvi Hospitals under the Healthy India, Happy India initiative in collaboration with The Hindu. Stress has quietly become one of the leading threats to heart health, and today we are here to understand its impact, learn how to manage it effectively for a healthier tomorrow. We have three esteemed speakers from Naruvi Hospitals, Vellore, who have joined us today. So, firstly, extending a warm welcome to Dr. Vinayak Shukla, the Senior Consultant, Cardiothoracic Surgery. A warm welcome to you, sir. We also have Dr. Ray George, Consultant, Cardiothoracic and Vascular Surgery. A warm welcome to you as well, sir. And we also have Dr. Mohammad Jafar Sharif, Consultant, Cardiothoracic and Vascular Anesthesia. A warm welcome to you, sir. With that being said, let's get the conversations started. Our first speaker will be Dr. Mohammad Jafar Sharif. So with an MBBS, MD in anesthesiology, and a DM in cardiothoracic and vascular anesthesia, he brings deep expertise in managing high-risk cardiac and thoracic cases. He also holds a fellowship in transesophageal echocardiography and has presented at national and international forums and has been recognized for academic excellence, research, and clinical innovation. He will be talking to us on the science behind the stress. So over to you, sir. The floor is all yours.
A very good morning, everyone. So it's an honor to be here today as a part of this distinguished panel, discussing a topic that affects millions yet often gets unnoticed. Stress, the silent killer of the heart. As we begin the discussion, I look forward to sharing insights, hearing different perspectives, exploring actionable strategies to help individuals manage stress and protect their heart. So let's get started. We don't have any potential conflicts, and I have nothing to disclose. So before beginning my talk, I would like to start with a simple fact that life is not a straight and easy corridor along which we travel free, but it's a maze of passages through which we must seek our way lost and get confused. But always, whoever has a faith, the door will open for them. Not that they would have thought of, but that will ultimately prove good for them. So you will understand the crux of this fact at the end of my talk. So when we ask a group of people, what do you think the stress is? So they often come up with an answer telling that stress is something that is overwhelming or that is which is harmful or something to be avoided. They often associate stress with anxiety, fatigue, or workload or issue with the relationship. So that is not the stress actually. So what is the stress in definition? So stress is some innate response that is present in all living organism. Okay, so it's a body's response to any physical, chemical, emotional, or an environmental stimuli, and the intensity of the stress response varies among individuals. Right, so it's an innate response among all the living organism. It is nothing that is unusual in someone. Right. Now, there is a big question after the stress. Once you tell stress, there is a big question called is it because only the big events? It's a big no. Because even a small daily stressors like a traffic jam or a work deadline or conflicts within the relationship that can cause a small amount of stress. And when it keeps on accumulating over a period of day, that becomes a problem. Now, consider a string of a guitar. When it's optimally tuned, then it makes a beautiful noise, right? When it is overstressed or overstretched, it tends to break. And if it is understressed, it does not make noise. So, what do you understand from this? If you should have a certain amount of stress for your daily living, right? So that keeps you going, that keeps you motivated and boosts your confidence. When you're overstressed, it tends to break, right? And if you are not stressed at all, then it's not fruitful. Now consider a lion that is sitting very like hungry. Okay, so it has to hunt a prey for its living, and a zebra comes in front, and zebra finds a lion chasing it. Now lion has an emotional stress that it has to somehow feed itself, and the zebra, it has to run for its life. Okay, so the one is an emotional stress, the other is a psychological stress. So these are all the two, this is the two kind of major stress that we usually see day to day. So this is what I call psychological stress. That is some emotional stimuli that is stimulating your stress response to build up and pumps the adrenaline and cortisol in your body so that you can face that challenge. That is called as psychological stress. So what do you mean by physical stress? That is physical stress is nothing but something that is actually seen by the zebra. It has to run for its life. Okay, it has to work something, or it has to either what we call in medical term as fight or flight. Either you have to face the challenge or run away from the challenge. Fight or flight response. That is what your stress response is all about. Okay, in medical terminology, what we call it as a homeostasis. What is homeostasis? Homeostasis is nothing but being in a balance, maintaining a normal heart rate, normal BP, normal blood body temperature, and so on, all normal. Okay, so if something that is going to disturb your homeostasis, that is, they are called a stressor. Okay, if that stressor is coming into your body, you will develop a stress response. Okay, that is what is all stress is all about. Now, there is something else is called as acute stress. You should have a small amount of stress, like the case of a lion. It has to hunt its prey. Once it is hunted, then it will go back to its normal life. Its heart rate comes down, it BP normalizes, body temperature normalizes, all everything back to normal. Okay, like it's similar for the zebra. Either it will be hunted or it runs away from the lion. So once the event is over, so they will be back to their normal life. That is called as acute stress. So acute stress, most of the time it is beneficial, right? So other examples like the person before giving speech, they become nervous. And if you apply a sudden brake to avoid collision, these are all acute stresses. You will get back to the normal life as early as possible. What do we mean by chronic stress? Uh, when you have a prolonged feeling of pressure and overwhelm that extends over a period of time, then it becomes a chronic stress. Like for example, if you are driving a car and you just keep on thinking that what if my tire bursts and what if my car topples. Okay, so now there is no stimuli, you are just assuming things. Okay, so it is the same amount of adrenaline and cortisol that is going to be secreted for the lion and for you who is thinking a lot, right? So there is a difference. There is actually no stimuli, but you keep on thinking yourself to create a stress response. Okay, so that is not going to serve any purpose. That is the moment when the stress hormones going to make an impact in your heart health. Now, so what is the impact of chronic emotional stress? It is based on many studies, it is linked to your heart disease, and it can cause early death. Right, now coming back to the proper topic, why you call stress a silent killer? Because it tends to accumulate gradually, and it is very difficult to identify to pinpoint the cause, what has caused my stress, and we often underestimate the intensity of the problem, and we have poor knowledge about what are all the complications of that stress. So this is a simple pictorial representation of how what stress creates in our body. So acute stress, it stimulates our adrenal gland, secretes adrenaline, other hormones like cortisol that will be flooded in our body so that we can start fighting. Okay, so this is a simple physiology of stress. Now, last but not the least, the younger generation has to be aware of something called as digital stress. When we are overloaded with information, social media pressure, work life imbalance, and fear of missing out, and people who are using smartphones or computers for a longer period of time, they tend to be stressed for unknowing reason. Okay, you don't have a physical or psychological stimuli, but you keep on building a stress within your body, so that creates a problem later on. So be aware, young generations. To end our talk, in my talk, so I would like to tell that it's not the stress that kills us, it's our reaction to it. Thank you.
Thank you very much, sir, for giving this webinar an awesome start. Thank you very much once again. To our audience, we have a Q&A box below. So in case you have any question on the presentation or anything about the topic, you can put up your questions in the Q&A box. And towards the end, we will have all of our doctors answer them for you. So let's make use of this chance and spam the Q&A box with questions about the topic. With that being said, we'll move on to our next speaker, who will be Dr. Ray George. His enormous exposure as a cardiothoracic surgeon in Coimbatore and a broad stint in the UK has helped him to groom as a fine cardiac surgeon. He obtained his membership of the Royal College of Surgeons of Edinburgh during his stay in the UK. He also has a special interest in off-pump coronary bypass surgery and adult valve surgery and is well exposed to valve repair techniques, lung surgeries, and vascular surgery as well. He'll be talking to us on the signs, symptoms, and hidden dangers linked to stress. So over to you, doctor. The floor is all yours.
Yeah, I thank Hindu and the Naruvi hospitals for giving me this opportunity. So, thank you, Dr. Jaffer, for that wonderful speech. So, as Jaffer has told about the role of hormones, the stress hormones, the cortisol and adrenaline on the heart, which causes various symptoms and signs in the body. Let's see how stress affects the body, how it affects the brain. In brain, there is difficulty in concentrating in your work, in your studies. You feel anxious, you feel depressed, there's irritability. And the heart, you can have high blood pressure. There is increased risk of heart attack and stroke. It may affect your joints and muscles, causing aches and pains all over the body. And it can affect your immune system, where the immune system is impaired and you become more susceptible to infections. It can affect your skin and hair, causing dry skin and hair loss. It can affect your stomach, which can cause constipation, bloating, indigestion. It can affect your reproductive system with decreased hormone production, decrease in libido. So how does the body respond to stress? The body responds to stress with various changes, starting with behavioral changes. You can have sleep disturbance. You may not be able to get good sleep. You may develop coping mechanisms like use of alcohol or drugs, smoking. You may have absenteeism from work or studies, have aggressive behavior. Emotional responses become irritable, depressed, intermittent crying. You have suicidal thoughts, constant worrying, and cognitive responses like negative, pessimistic thoughts, poor memory, and physiological responses causing high blood pressure. You breathe faster, your heart starts racing, your mouth becomes dry, your muscles become tensed, and your biochemical changes like increased metabolic rate. You eat more, you have appetite, but you don't gain weight because of the hypermetabolism. And your endorphin levels, which are the feel-good hormone levels, goes down in the body. But let's see what is the direct effect of stress on the heart, which is the main topic here. Stress can cause a number of consequences of the heart. Number one, it increases the heart rate. When the heart goes faster, the heart has to do more work. So it needs more oxygen-rich blood supply to its muscle. If somebody is having a block in the blood vessels of the heart, it can precipitate a heart attack. It also increases the blood pressure. And this high pressure, the heart has to pump against high pressure, and it causes overload to the heart, and that can fail. Stress can also cause a lower threshold for cardiac arrhythmias. What are arrhythmias? They are abnormal heart rhythms affecting the smaller and the bigger chambers of the heart, which can cause cardiac arrest or sometimes formation of clots within the heart. The other problem with stress is it can cause narrowing or spasm or constriction of the heart's blood vessels, and the blood flow is reduced, leading to heart attack. So how does chronic stress affect the heart on a long term? Chronic stress contributes to persistently high blood pressure, which itself is a risk factor for heart disease. Then the heart rate also goes up. On the long term, it is the body's response to stress to speed up the heart to pump more oxygen-rich blood to the muscles. But this prolonged elevation of heart rate can strain and tear out the heart and cause heart disease. Thirdly, this inflammation. Stress can promote inflammation within the body, especially the blood vessels or the arteries. So what is inflammation? Inflammation is a sort of response by the body to any injury. And inflammation on a long-term basis, when there's chronic inflammation, it plays an important role in developing atherosclerosis. So what is atherosclerosis? It's a buildup of fat, cholesterol, and plaque in the arteries, which can block the arteries and lead to heart attacks and strokes when it interferes with the blood supply to the brain. So far, we discussed the direct effects of stress on the heart. There are some indirect effects as well. When you have severe stress, body develops a lot of coping mechanisms to cope with the excessive stress, like change in eating habits. You indulge in overeating. You start eating unhealthy junk foods, which increase the risk of obesity and heart problems. You start smoking. Sometimes you have excessive alcohol consumption or use of drugs, which again is bad for the heart and other organs in the body. Stress can also make it difficult to maintain regular exercise. One may stop going to the gym and have a sedentary lifestyle. Let's look at a few studies which shows close association of stress and heart problems, heart disease. This is an American Medical Journal study which found that chronic job stress in the workplace after a first heart attack was shown to have an increased risk of recurrent heart attacks after the first attack. This study monitored 972 first-time heart attack survivors, means who survived the first attack, and they found that those patients who had the first attack, who returned to extremely stressful jobs, were twice or more likely to have a second attack when compared to those who went back to jobs with less stress. So this shows the importance of stress in the workplace and the association with the heart disease. There's another study from Cardiology Journal in 2020, which shows association of stress levels with long-term mortality in patients with peripheral artery disease. Peripheral artery disease involves the arteries supplying or the blood vessels supplying the limbs. This study was involving 765 patients, and what was the finding? Again, high stress levels in the first year after diagnosing disease. They were associated with a high risk of dying or mortality in the subsequent 4 years. This is another interesting study from the Yale School of Medicine, which showed that an angry, severely stressed heart can cause sudden death. Yes, that's correct. An angry, severely stressed heart can lead to sudden death. This study tested the effects of emotions and anger on individuals who had heart disease and implantable heart devices. These devices, they send electric shock when you have an abnormal heart rhythm. The researchers told these patients to think about something that made them angry. The patients were tracked over 3 years to see who experienced the rhythm, abnormal rhythm, and needed a shock. And the findings were interesting. The individuals who were most prone to anger, they experienced abnormal rhythms and they needed a shock. So what was the conclusion? The data concluded that if you focus the therapy on helping patients deal with this negative emotions and anger, it may help to reduce the occurrence of these abnormal rhythms and death. Now, this is a syndrome called broken heart syndrome, which is rarely known among the public, which is otherwise known as stress-induced cardiomyopathy. It's a temporary heart condition which involves normal heart when they experience intense emotional stress, like loss of your spouse or some traumatic event in your life. It is characterized by weakening of the left ventricle, the heart's main pumping chamber, and you have symptoms like a heart attack. This is more common in women after menopause. It also affects young women and men. People with underlying anxiety or depression are more risk. The symptoms are just like in heart attack. You have chest pain, breathing difficulty, fainting, abnormal rhythms. But mind you, it occurs in patients with normal hearts who doesn't have blockage in the heart blood vessels. Treatment requires special heart medicines. But the good news is that the heart muscle usually recovers quickly without permanent damage. But broken heart syndrome can recur after another stressful event. So along with the medications, the therapy should be guided towards counseling and mental health support to address the underlying emotional stress so that further occurrences are prevented. Now, other than the heart, the other complications of stress include diabetes. Because of insulin resistance, they can develop type 2 diabetes. Because of the high cortisol levels, they can have weight gain, obesity. With metabolic complications, you can have cognitive decline, impairing the memory because of the high cortisol levels. You can have anxiety, depression because of the neurotransmitter disturbances in the brain and disturbance in sleep. As I told you earlier, there is immune suppression, making you vulnerable to infections and inflammation, causing inflammatory diseases. To summarize, stress increases the heart rate, which can cause your heart to develop abnormal rhythm and heart muscle issues. Increased blood pressure may cause symptoms associated with hypertension, which itself is a risk factor for heart disease and stroke. The increase in fat, cholesterol, triglycerides, they may cause atherosclerosis. That is, arteries becomes thickened with plaque over time, causing block in the arteries, which will lead to heart attack. Then the metabolic issues because of the overeating, increase in deposit of fat in the abdominal area, causing metabolic syndrome, which itself is a risk factor for heart disease. Thank you.
Thank you very much, Doctor, for your
Yeah,
superb presentation. Thank
yeah.
you very much once again. Again, to the audience, in case you have any questions on any of the topics, you can use the Q&A box to put up your questions, and towards the end, you will have our doctors answer them for you. And with that, we have our final speaker. We have Dr. Vinayak Shukla here with us, who will now address the gathering. He is a highly respected cardiothoracic surgeon with over 3 decades of experience in academic and clinical excellence. He served at CMC for over 30 years, retiring in 2023 as a professor and head of the Department of Cardiothoracic Surgery. He is renowned for his surgical skills and a dedication to education, and has mentored numerous trainees who now serve with distinction across India and globally as well. His topic is managing stress for a healthier heart. So over to you, Doctor. The floor is all yours.
Yeah, thank you very much. Actually, I served for 37 years and not 30 years. So the small correction, but the stress part that we have been discussing, Mohammed Jafar telling you this and Ray talking about endlessly about you. Let me explain in a few words, what is the stress? You get up in the morning and then mother says, the mother says, get up, it's time to go to school. The child says, 5 minutes more, mama. And then she goes back to cooking, and from the kitchen she shouts, get up, it's time to go to school. Again, the child is little late, then gets up, mama, I cannot find my socks. Then where is my compass box? And then she comes running to find the compass box and the socks, and then what she is cooking on the fire gets burnt. And while she is going back there, the husband is shouting, where is my mobile phone? I can't find my mobile phone. And then there's all chaos. This is what is stress. And I, over the years, have learned that what I'm going to talk about is something by my slides, but what I have not put in slides is the first part is organizing yourself to put up with stress. If you, as a parent, inculcate in your child in the beginning itself that before you're going to sleep, lay your socks, your clothes, your bag, your lunchbox, everything clearly on the bed before you go to sleep, morning can be so peaceful. This has to be inculcated in all our children. Like we plan for surgery the next day, the day before, if it is a complex surgery, the steps are discussed with the entire team. That this is what will happen. This is what I want. This is what I want to start half an hour late because I'm expecting a problem with this particular valve. So it is more of organizing yourself to put up with stress. You cannot avoid stress. Stress is a part of life. But you can surely overcome it. You can learn to grow with it. The problem is that we are not taught to deal with this. My parents were so particular that even for the next morning, the shoes have got to be polished and kept so that morning time you don't dirty your hands trying to polish your shoes. If this starts at an early age, then you organize yourself. And then when you go out, you're smiling, you're very happy. You have not been stressed out before you leave home. That is the part which I always insist is that if you want to put stress is not your enemy, as Jafar says and they say, it is a part of life. You have to understand to organize yourself and then you start enjoying the stress. As someone said, if your job stresses you, you're not meant for your job. I have gone through this exercise for last so many years and I realized that whenever there's a problem, we break it up. We de-stress ourselves by breaking it into multiple bits. Okay, Ray, you will do this. Jafar, you will do this. I will do this much. And the problem is sorted. So that was one part of which I wanted to tell all of you about how to put up with stress is getting yourself organized. And the second part is that you can take up a hobby. You can take up something which you like to do, something which will take away your mind and your entire attention so that you can de-stress yourself. You cannot run away from stress, but you can have a way out. You can have a break in your stress so that the stress level comes better. When you take up a hobby, the stress doesn't go away. The stress is there, but during the calmness of your mind, the subconscious mind automatically comes up with a solution. And that is why we always insist to take up a hobby. Next slide. See, engaging in a hobby can be an excellent way to get rid of stress. It provides an outlet for your relaxation, your creativity, and this is how the hobbies help you manage your stress. This is all the scientific basis of management of stress by a hobby. It distracts you from your worries. It shifts away your concentration. I cannot see this has to be minimized. Sorry about that. Hobbies, it shifts away your focus from the stress. And what you do, you start concentrating on the hobby, which is a very, very good thing. And then the neurochemical systems come in your way in the brain, in the system. And then that also starts reducing your stress. Activities like painting, gardening, music, or sports, they stimulate the brain's reward system and they reduce the stress. Then your mindfulness increases, meditation, cooking, or playing an instrument. It reduces stress to a very large limit. I remember when I was all alone and I had problems with managing stress, my mother always told me on the phone, start cooking. And then when I used to cook, those days we did not have these things like the mobile phone and the video camera. Then she will tell me, after you have done these few bits, you call me again on the landline, I'll tell you what to do. So I will cut, chop, keep ready, and then one by one she'll tell me. So cooking is a very nice way of getting rid of stress. She wanted me to cook, not that I couldn't afford outside meal, but her aim was to reduce my stress. What do these hobbies do? It provides you a sense of achievement. Whether it's like learning a new skill, a craft, or a hobby, it creates a sense of achievement. Oh, I have achieved this. And it is a very good way of relaxing. It boosts your self-esteem and reduces your anxiety. Then there are physical benefits of the various hobbies that you take up, like running, swimming, dancing. As Ray was saying, that the heart and the vascular system is most stressed during these things. If you take up a physical activity, it not only helps you, it takes your mind off at the same time. It boosts up your entire immune system. Then social interaction. We are all human beings. We need to talk. We can't live in isolation. People who live in isolation, I really hats off to them. But the social interaction is a must to de-stress yourself. Get out of your room, talk to somebody. I can never stay quiet if I'm in the train. Also, before I get down, I've made two friends. You have got to have social interaction. And then enhancing problem solving skills like chess, puzzles, or coding. What happens with these things? You gradually get trained to handle stress, and each time you do this, you learn to handle stress with more resilience. Then you have got hobbies which are designed to ease stress, like painting or drawing. People do, they pick up the colors, they pick up the mood. If you look at these various paintings, you will find, oh, this is a wonderful painting, and I really love this, what the artist, but it is not that what the artist is showing. He is just expressing his thoughts in colors. When he draws something, he draws what he already has in his mind. So it reduces your stress to a very, very big limit. Then journaling also organizes your thoughts, reduces anxiety, and improves your self-awareness. Music, it can be therapeutic, and it also releases all the stress that you have. That is why you will find children taking up music classes. The schools are now having mandatory music classes for children. Not that they are going to produce big musicians, not that every child will be able to compose music and say, oh, this is what is wonderfully played, or this is the canon in D that I want you to play. But the child gradually learns to de-stress himself. The school itself gives him stress, but 1 hour of music classes, when they play around, he de-stresses himself. Then the physical activities. Every corner of the town nowadays has yoga classes because life has become so hectic. Families have become nuclear. We have all moved away from joint families, and every wife and husband working to make the ends meet. The children coming every day, there is a neat competition for them. Every day there has a challenge for them. So how to relieve this stress? Then comes the yoga. The yoga teaches you how to de-stress yourself. Yoga is not telling you anything new. It is telling you something which is already there. So you have got to learn to de-stress yourself. And that is why these yoga classes and yoga teachers come and have groups. And yeah, I'll be very surprised if you ever found a yoga teacher teaching one-to-one. They always teach in a group. Because the moment you get in a group, your de-stressing has already started. Then walking or running. You will find all these big leaders and all this, they always go for a 20-minute or 25-minute walk in the morning. It is not walk to protect the cardiac system. It indirectly does protect, but while walking, they are thinking. While walking, they are thinking constantly about how to run the show for the whole day, how to manage the show. I remember a very, very highly placed Central Custom Excise commissioner. Her biggest hobby was 10:30 she'll come to office and then she'll go shopping and come back at 3 o'clock. Window shopping. She'll come back with a small item that she has purchased for her house. So one day we asked her, why do you do this shopping every day? She said, I de-stress myself. I know what files are there on my table. I know how will I deal with them according to the law. But I have got to organize my thoughts before I give a judgment on each of those files. So I use this time, I'm de-stressing myself. At the same time, I'm getting to a solution. Then one more physical activity, dancing. You have got all these dancing clubs. You will find these children go out in the night dancing. It has taken a little bad turn, but that is how they all the the desk jobs which involve them from 8 o'clock to 10 o'clock. Over the weekend, they go dancing. It is just to de-stress themselves. And I find it a very wonderful way to de-stress their activities. Then meditation. They'll say meditate, meditate. But I find this little bit awkward because I find it difficult to meditate myself. I find that my work, my surgery itself is meditation. If I keep operating, my stress levels are low. So, in other words, what I'm saying is love your work. It will take away your stress. That is most important. That is the key word, that meditation means you do your work with your whole heart and you forget everything. And that is what takes away your stress. Gardening, you connect with nature, you see the plants grow, you see how the bulb you planted has blossomed into a wonderful red color lily. That is what soothes yourself. You find the nature growing, and the nature grows without any stress. You just plant the bulb and it takes its own time and blossoms. Then breathing exercises. This is a simple, effective way. The yoga teacher and all tell you to breathe in, breathe out, feel the yellow breath coming out, see the purple breath go in. All this, they're taking your mind away from the thinking of the stress, and they're adapting you to the management of stress. Then reading. This is a wonderful thing. If you go out with a book under your arm and come back with two, this is the best thing. If you read and you read, I know of friends which the only requirement is give me a book and a corner in the house, I'll be all right. And reading is a wonderful habit. You can carry a book anywhere. You don't need anybody's help, or you don't need multiple gadgets, and you can take your stress off. Cooking or baking, as I always said, it is a creative process. Puzzle solving also. I remember of a secretary who worked with us. She would come with the newspaper in under her arm in the morning, 8 o'clock. But she will not check the newspaper till 10:15. 10:15 is her break time, and break time is 20 minutes. So 10:15 to 10:35, she is doing the crossword puzzle and having a cup of tea. And if the phone rings, she would not answer the phone. This is my de-stressing time, she said. And hats off to her. She would do the crossword puzzle, have a coffee, and 10:35, the newspaper is put away, the coffee cup is put away, and she's back on the desk, completely relaxed. So these crossword puzzles and all this, they take away your mind for a short while, and you come back recharged. Then these social activities, volunteer work. The town has organized a cleaning program. The town has organized a blood donation program. You're going to volunteer for that. We are all going to run, and each one is going to buy a t-shirt. The money goes to the poor fund. Is also a wonderful way of volunteer work and de-stressing yourself. Then joining a book club or a hobby club where everybody has got a common hobby, and we exchange book, we exchange knowledge, and we do ourselves good. Then learning a new skill. This learning a new skill, which I want all of you to understand, is because if you learn a new skill, you keep your mind active. You keep your mind, growing all the time. The biggest problem that we face is the Alzheimer's. And if you develop a new skill, this will keep away the Alzheimer's or the dementia, as people commonly know. And then the other thing is that people say it's very difficult to start a hobby or to start a new thing. No, you can start a small hobby, small things. Keep one or two hobbies that intrigue you the most. Set simple goals. I'll practice meditation for 5 minutes a day. I'll journal twice a week, or I'll walk 10 minutes every day. And before you know, it becomes a habit. You should schedule it like an appointment. Block 15 minutes of your daytime that I'm going to do 15 minutes of this work only, no other work. That will if you schedule it like an appointment with the doctor or with the lawyer or with the prime minister, then you find that you're working with a fixed schedule, which is the best thing. Then you create a dedicated space. oh, I've got this place, I will do my embroidery or my kitchen work or my writing, my letter writing, or my chalk carving or painting. Then that takes away all the stress. Once you enter that environment, everything is sorted out for you. It reinforces the habit and minimizes distraction. Make it enjoyable. Pick a hobby that feels natural and engaging rather than forced. If you think journaling is too tedious, try voice recording your thoughts. If you think like hobbies like chess and puzzles are too intense, go for gardening or music. Integrate it with your existing routine. Listen to music while you are commuting. Meditate before bedtime or solve a puzzle during lunch. This prevents the hobbies from becoming an extra burden. They You inculcate these hobbies in your day-to-day activities itself, and you find that they are a wonderful thing. Then you find a community or support. Join an online group which shares the same motivation and the same thing. Then reflect on the benefits. Keep a track on how your hobby improves your mood and stress level over time. If something isn't working, don't hesitate to adjust. It's all about finding what you truly help you unwind yourself. So go ahead, change. Then you have to find joy in small things. That is what cultivates happiness and reduces stress. This I want to tell you that you have to learn finding joy in small, small things, in the moments of beauty, simplicity, and everyday wonders. Be present in the moment. Don't try to think about what is going to happen tomorrow. Stop worrying about the past. This will appreciate your sensory experiences. Have you ever noticed that the feel of a warm breeze, the scent of fresh flowers, or the sound of rain, these tiny moments have a calming effect and reconnect you with your surroundings? Suddenly, if the wind blows, what does one do? Suddenly, if you step out and the wind blows, what do you do? What will adults do? They will adjust the hat. But what a child will do, a child will just open his eyes and enjoy the breeze. Look at him. There's nothing known to him other than enjoying the breeze, and it doesn't stress him out at all. That is what you are supposed to do. Celebrate small achievements. Not everything has to be a major milestone. Completing a task, learning something new, or even making someone smile are victories worth acknowledging. Finding joy in everyday work, cooking, reading, organizing a space, these are therapeutic and when done without pressure. Engage in simple activities. A kind message from a friend, a good book, a funny mime, or even a delicious meal is take away your stress. And then cultivate gratitude. Take a moment each day to reflect on things that made you happy, no matter how small. And I know of people who write it down, who thank Almighty for everything, small, small things, writing, appreciating their friends, and cultivating gratitude takes away your stress. You start realizing how happy you are for these things, which has got to be done without fail. And about my gut feeling is that all of us do everything, but never practice gratitude. Life is always flowing, changing. You can cling, life is destroyed. When you hold on to anything, you cease to live. This is by Anthony de Mello, and this author is wonderful person. He's one of the Society of Jesuit priests. And if you the viewers, if you ever find time, please do read Anthony de Mello. To acquire happiness, you don't have to do anything because happiness cannot be acquired. Does anybody know why? Because we already have it. How can you acquire what you already have? Then why don't you experience it? Because you've got to drop something. You've got to drop the illusions. You don't have to add anything in order to be happy. You've got to do is to drop something. Life is easy, is delightful. It's only hard on your illusions, your ambitions, your greed, and your cravings. Thank you very much for your time and attention.
Thank you very much, Doctor, for that lovely presentation. I think I also had so many points that I could resonate with, especially the gratitude part, because like you had mentioned,
Can I
like,
have 2 minutes more to say something?
please, sir, please go ahead.
See, I have been operating for so many years. And when I was in 1968, my school teacher taught me how to do cross stitch. How to do cross stitch in 1968 in fourth standard, and I still practice doing it. Can you see it?
I think the background is covering it, sir.
You
No.
cannot see this?
If you can maybe
Okay, I will say. So what I do is that I carry a cross stitch pattern with me wherever I go. At the airport, if the flight is 2 hours late, I do the cross stitch. If I'm stuck at home and if suppose something is not working as per order, I do the cross stitch. I relax completely. I don't take up these small issues as an hindrance. So you can take up any hobby and do. No worry at all. Yes,
Absolutely.
continue, please.
Yeah. Like you had mentioned, it's the little things that give us the biggest joys, and your
See, can you
presentation,
see this?
we can have a look at it. So correct, yeah. The stitching part, yes, it
Yes.
looks
So I
lovely,
do
sir.
this all the time, and my advice to all the viewers are take up a hobby. It is very simple, and you will de-stress yourself. Nothing to worry about it. Stress is a part of life. If you want me to spell life, I'll spell it as STRESS.
Love the explanation. So thank you very much for that very amazing presentation. Truly a lot of things that we all can learn from. So with that being said, I was going through the chat box while the presentation was happening, and I saw a few similar questions. So I'll try to collect some up as many questions as I can in the form of a discussion to make sure we answer all that we have in the next 10 minutes. So I saw people mostly asking about their jobs. So, post-COVID especially, we are more like digital jobs are becoming more popular. We're spending more time on the screen. We are working late hours, so and that is also leading to stress among a lot of people. So what advice do you have for people who are on the go all the time and spend more time on the screen and do desk jobs? So if any of you can give us any insights on that, it would really help our viewers.
Ray, you'll answer or you want me to answer?
You answer, sir. You
See,
Okay.
the screen time that you're saying and this job, I think the problem lies with the person himself. They have got to, like, we enter the office at 8 o'clock and we finish the work in the and by 5 o'clock we go. They should time themselves that I'm going, just because they have the liberty to work from home, they continue working, continue working, continue working. No. You pretend that you are in the office while you're at home and doing the work from home. 8 o'clock, I switch on my computer, and 4 o'clock, I switch it off. That is what it is. That is the biggest problem we are facing, is that just because you're from home, you don't have to run here and there. You just put on a t-shirt, sit in front of the screen and work. You work endlessly. I blame you yourself only. Time it. 8 o'clock monitor on, 4 o'clock monitor off. With 1 hour of lunch break, it will not stress you.
Planning is important, and yes, you answered it complete justice to that. Thank you very much, Doctor. I'm going to drag in Dr. Ray George in the conversation to answer our next question. So, I also see a lot of questions in the chat box about overthinking. Like, people have complained that things are running in their mind automatically. So how can they control their overthinking and manage this effectively? Any thoughts from you, Dr. Ray George?
I think it is, sir, already mentioned that if you write that down on a piece of paper, each prioritize your things to do and your thoughts on a piece of paper, and maybe you take few minutes to sit and calm down and take one at a time. This is one way of getting over this stressful issue. And yeah, I think that is the key to it. So yeah.
Yeah, thank you very much, sir, for your thoughts on that. Also, we have a few more questions that are coming up on people here want to know the difference between acute stress and chronic stress. So if any of you could break that down and give us a comparison, it would be great. Maybe Dr.
Jaffa, you can
Yeah,
talk about that.
so acute, like I don't know, the maybe non-medicos may not be aware of the word acute and chronic. Acute is something that is short lasting. Okay, it lasts for it is triggered by something, it lasts for some time, and it will be terminated at some point of time. Okay, chronic is endless. We don't know, it may last for a long. So acute stress means something, there is a stimuli that is going to turn you on, and you are going to work on it. And once the work is done, then that the stress is terminated. Okay, so it is the same. I will take the same example of the lion. When it is hungry, it will search for a prey. Once it hunts a prey, it will eat itself and go back to its normal life. That is acute stress. It stress itself for some period of time. Chronic stress means the people who think over, like daily, since morning, like while getting up from the bed, I think that will I miss my bus, or will I miss my train? Then on getting the train, I start thinking that will this train reach on time? Then after reaching on time, I start to think that will I reach my office on time? After going to my office, I used to think that will the office get over on time because I promised my wife I will come back.
And then
So
you have to put up with the boss also.
keeping on thinking of no of for no reason, that is chronic stress. If it keeps on building the adrenaline and cortisol in your body for no reason, that becomes a chronic stress. I hope it makes it clear.
Yes, absolutely, sir. That was very good explanation. Thank you very much for your thoughts on that. Dr. Vinayak Shukla, we have a lot of questions about you as well in the chat box. Like I had mentioned, 37 years of experience, both clinical and academically. Like we have questions here on how did you manage your stress during these long years? Because when you're practicing at CMC, when you were the HOD, any tips from your end
Yes,
to our audience?
these 37 years have taught me so much that I cannot put it in words in just 3 minutes. But I learned to manage stress in a wonderful way, that certain things will happen as they are going to happen. You can't change. You have got to learn what you can change. And this was taught to me by Dr. Jayaraj and Dr. Stanley John. Dr. Jayaraj would always tell me, you do your part well on the table and the patient will do well later. You cut shortcuts, you make shortcuts, you try to do something, you patch up something, and then the patient has endless problems in the ICU, and that is a constant 48-hour stress till patient is not out of the ICU. So I learned this, that do your job well. You do your part well. That is what takes away all the stress. And I practice that till today. If I have a slightest doubt about something, I make sure I go back to the net, I read about it, I organize my thoughts, and that is how I put up with stress. And then the other thing is that you cannot get your patient off your mind. Once you have operated, you carry the patient home and you're thinking about it. Then how do you deal with this? You deal with it? Yes. All what has to be done, we have done. Now give the system time to recover. That is what takes away your stress. You cannot do anything beyond that, because this God-created body will recover by itself, given time, provided you have done the right thing. That is how I started putting up with stress. During my initial days, I would have sleepless nights when I was doing duty. But now I can sit in the ICU and sleep, because I know each patient, how will they behave? What am I supposed to do? What has to be done? What will be the outcome? And give the patient time to recover. That is what it is.
Absolutely, sir. Thank you so much for sharing your thoughts on that question. Our next point of discussion is for Dr. Ray George once again. So we have people here questioning on what to do if stress interferes with their sleeping schedules, like they don't get sleep, sleeplessness. Any thoughts on that, Dr. Ray?
Yeah, that's a good question. Often it affects your sleep, like you get up in the middle of the night. Sometimes you wake up early in the morning, or sometimes you get difficulty in the onset of sleep itself. So there are a couple of things which you could try to do at home. Like they say you take a warm bath, in the evening, and have your meal little early, and don't stuff too much. Take a light meal. Read some books if you are okay with books, and switch off your lights. Do not have any devices, any screen time, let's say at least 2-3 hours before sleep, and try to go to bed early and try to calm yourself down. And then sometimes some people say that you take some milk, which may help you with the hormones helping to sleep. And these are things you can try to do to get some sleep. So, and some exercise routine would help you. And do not do any exercise, like 3 hours before sleep. It should be better be done in the morning. and calm your mind. Yeah, yes.
These are the simple tips for
Can
helping
I
us.
can I add something to it?
Yes, sir, please.
Yeah, the persons who don't get sleep, the usual, the 99% times it is the worry about the next day. So what we have been doing, even if I have got to buy a kilo of potatoes, I write it on a piece of paper that tomorrow I've got to buy this. So before you go to sleep, you should have your day planned on paper. And then it takes away your stress. You sleep better. Once you have planned yourself that morning, this has to be done. I have to meet so many people. I've got to put up with Priya. I've got to put up with Hiba for my Hindu meet. Then I'll be going home to have lunch. Once you have written it down, then you can sleep peacefully. You never go to bed without having your plan for the next day on paper. And let me tell you, this will induce the best sleep.
Planning is
And
extremely important.
to add about caffeine,
Yes.
soft drinks, carbonated drinks, yeah, to be precise,
Some
before sleep, yes.
really great tips coming in. Thank you very much to both of you for sharing your thoughts on that. I think we'll take two more questions before we end the webinar. Maybe Dr. Jaffer can join in for the next question. So we have people here asking, how can we manage the gut response to stress, such as bloating, stomach pain, vomiting, before an important events or during exams? So any thoughts on that, doctor?
Yeah, so before exam or before giving a talk or before addressing a gathering, so people usually tell that there are butterflies in their stomach. Okay, so that's not actually the butterfly. It's the response. It's the stress response that is stimulating. Like your gut starts moving faster. Your those things. Okay, so it's not actually the stress causing the problem, and it is not something that is problematic. Okay, it is a normal response for your body, and it's like a uh, it's a body that is preparing to face some challenge. On the process of that, these are all some other things that is happening in your body which is not needed. Okay, so some people, like if they have exam tomorrow, they may feel like lack of appetite may be there, lack of they tend to sleep very less, they don't get sleep. So these are all not the direct effects of stress. It is the overthinking part of the stress. Okay, so there is a definite difference between an anxiety and a stress. Both are not the same. Anxiety, what do you call it, as the thought, it is your thought about stress. Okay, so like told you before, there may not be a stimuli, but the thinking part of the stress makes more problem. Okay, so there are two-person who is very casual, that he thinks that okay, whatever it is, it just made okay. So like me, I'm going to anesthetize a very difficult case tomorrow. Okay, so I have been doing that for a long period of time, so it may be a day-to-day practice for me. But for a beginner who is going to do it for the first time tomorrow, so it will be a different sort of experience for him. So he may be overthinking about it, he may lack his sleep, he may lack his appetite. So it is all about the thinking part of the stress. So anxiety, so what you are talking about is the anxiety. So this bloating, stomachache, all that, or the anxiety part of the stress. It is not the stress per se. Okay, as Dr. Shukla told, you need certain amount of stress for a daily living. Okay, no second thought about it.
Thank you very much, sir, for your thoughts on that. We will just do our last question with all three of you giving us your thoughts. So, closing thoughts on what is your one secret tip, or what is your one mantra that, if you follow this, stress will not come near you. So, any closing thoughts from the three of you? We'll start off with Dr. Vinayak Shukla first. Any thoughts from your side, sir?
I've given my thought already. Yes, keep
Any closing
smiling.
thoughts?
Keep smiling no matter what happens.
Smile is the solution. That is Dr. Shukla's advice. Dr. Ray George, any
Yeah,
advice?
take up some. I think it's Dr. Shukla sir's presentation was full of those.
Yes.
Take up some hobby and some exercise or some sort of routine.
Yes.
Making a routine, yes, that will help
Yes.
you.
Yes.
And yoga, meditation, something which you are comfortable with. Yes.
Yes, absolutely. So yeah, and Dr. Jaffer, any closing thoughts from you?
like in medical term, we say fight or flight. Either you face the challenge or run away from the challenge. Okay, so and you're going to go through that process. So nothing is going to change. So it's fight or flight.
Absolutely. So I love the closing thoughts that came in. A lot of advice from all of you coming up for all of our audience. So with that, we come to the end of this webinar. I think even me just moderating this made me a little stress-free because I got tips from all of you and it just makes me feel so good. So thank you so much, three of you, for joining us today. A big thanks to all of the audience for joining us. We're glad to have you on this journey towards awareness and well-being. And to all of you, thank you very much once again and have a great Sunday ahead. Thank you so much and take care.
Thank you.
Thank you.
Thank you.